Welcome back to my channel. My name is Irene, your ER nurse, and since the stay-at-home order, we've had a total of 2,763 cases of COVID-19 positives and a total of 21 deaths here in Utah. This week we have a mix of topics, or what we call in the Philippines a halo of topics. We are talking about fines in different states for not social distancing, the effects of wearing an N95 mask. Gabby shows us that. And then we have a discussion with our respiratory therapist, as well as our week's questions. All right, so since March 27th, the stay-at-home order, we've been doing pretty good here in Utah with those numbers. But some places aren't doing so great with added fines. Alaska actually has up to 1 year in jail and a fine of up to $25,000. Wow. Colorado up to 1 year in jail and $1,000. And something unique is happening in San Diego. San Diego, some citizens are being fined $1,000 for just eating a meal in their car and sitting at the beach, just looking at the beach. They're getting fined $1,000. That is a lot. The beach, where is my hometown basically, used to be my sanctuary, my happy place where I go to when I was sad. And I know social distancing is important right now and needed to flatten that curve, but is this really going to be effective? And will people be responsive, or will it be really detrimental because so many people are losing their jobs right now and make the situation worse? Are we going to relinquish all our rights at the end of this and wonder what happened? It's just a thought. In the ED, we've all been fitted and given an N95 mask to use when we don't have time to wear the PAPR. And if it's worn correctly, you'd know how uncomfortable it can be. Here, Gabby uses it for an hour and we get her thoughts. Okay, so Gabby's been kind enough to show us her putting on her N95 mask. And she is going to wear this for an hour. And I'm gonna actually...
Is that on there good?
Yeah, and then you gotta like press it, they said. Press it.
Push it down. Yeah,
Mm-hmm.
let's go.
Do you feel like you have a good seal?
Yeah.
Right.
Under my chin too feels good.
And you're kind of moving around making sure you're good. How do you feel wearing it?
I feel suffocated.
You feel suffocated? Does it hurt at all right now?
It doesn't hurt. It just feels tight.
Just feels tight?
A little bit, yeah.
Yeah, and then you have to put a mask on it. That's what we were told to do here.
To kind of protect it.
So we kind of have like 2 layers, right?
Yeah, 2 layers on here. Feel a little...
How do you feel?
What are your thoughts? Claustrophobic. And then in my eyewear too.
Yeah, and then your eyewear.
So we're going to see how my face looks in about an hour.
Okay, so it's been, what, over an hour now, and Gabby, what are your thoughts on wearing this just for that hour?
It's so uncomfortable. I feel like I don't breathe well. My ears, I didn't think that would even be a problem, but I think just the gown or the mask over it slides down my head, and that feels pressure here. My nose, because we're supposed to pinch it on there pretty good. It feels like that's gonna leave a mark. Just itchy. I can't, just so much right here. Can't breathe.
All right, so let's take it off and then see. Oh,
Am I red?
a little bit red.
I know, it feels like so much relief though.
And that was only just an hour.
Yeah, my nose feels like it's crunched on my face now.
Awesome. All right. Well, I can't believe
that was just an hour. I can't imagine doing that for 12 hours.
For some of the healthcare workers over in New York that are wearing it for 12 hours.
Yeah.
You guys are rock stars.
We
All
are.
right. Okay.
Woo.
Thank you.
You're welcome.
I can't imagine wearing an N95 mask for 12 hours. And for you frontliners out there wearing it for 12 hours straight, I salute you. Our RTs, or respiratory therapists, are a fundamental part in the hospital. They assist us with respiratory treatments, they help us in codes, and advise us when using ventilators on our patients. Here is my interview with Ashley and Lyle, two of our RTs in the ED. Hello, introduce yourself.
My name's Ashley. I'm a respiratory therapist.
And I'm Lyle. I'm another respiratory therapist.
All right, and both of you play such a vital role in our hospitals right now. Explain to the viewers what your role is here and what do you do for our patients?
Well,
We help people breathe is the whole gist of it. Anybody has any breathing problem, whether it's just you have asthma or you can't breathe at all, sometimes we'll have to put a tube down your throat and put you on a ventilator that you've heard a lot about and help you breathe.
yeah, we work in all areas of the hospital. So the emergency room, labor and delivery, the ICUs. We work with pediatric patients, anyone that is short of breath or maybe wears a CPAP, you're on a ventilator. Those are the people that we see.
So you're very, very important right now, especially with, as you know, COVID-19 is what everyone's worried about. What advice would you give to our viewers or patients that come into the ER worried about COVID-19, and how are your roles in this?
Oh, geez. Our roles are, anybody that has COVID-19 and obviously a respiratory patient will probably see you all. The first thing I tell you is just like, if you feel like that you're sick and you're having a hard time breathing, please come in and see us. That's really important. But if you just feel like, I just feel a little bit achy today, something like that, maybe not so much, because we get plenty of people we see already, and we just don't need you clogging up the the rooms.
Yeah, it's good to have an awareness of just how you're breathing in general. Like, are you getting short of breath just laying down? Are you getting short of breath sitting up? When you go up the stairs or activities that you would normally do, are you extra short of breath? Plus you have a fever, plus you have a cough, plus you have all these things, then you would, and you don't think you're getting any better. It's been, a good amount of time, then definitely come in, and because you could turn, get worse quickly.
Yes, if you're short of breath, please come in, because it's a really bad thing, and it does worsen really fast, and that's what scares us the most.
And how has it been lately here? I know we didn't interview you guys who were very important in the first video, but how do you feel it's been here in the ER lately with respiratory issues?
I think the wave hasn't quite hit us yet.
Yes.
We're just anticipating what's to come.
Yes, we have had a few busier times. There's ebbs and flows, but overall it's not like I've seen it. We're not New York City by any means.
Okay. What are your concerns in the next couple weeks when we do hit those, when we hit our peak?
That there are enough of us to take care of the patients. That just scares us, because there's a limited amount of respiratory therapists. They talk about limited amount of ventilators, but we could get all the ventilators we want, but we're the ones that run it. You can't make more of us. That's the scary part for me.
Yeah, that would be scary. And then my last question is, for people already who have respiratory issues like asthma, what advice would you give to them right now? Especially they're at home, they're scared, they know about COVID-19. What advice do you give to them? What things do they need to look out for, or what should they do at home, especially since they already have respiratory issues?
I would say make sure you have your inhaler that you usually would use if you got yourself in trouble. Like, make sure you have those medications already. You call in to Connect Care, let them know that you're an asthmatic, and they'll write you a prescription, just so you have something to treat yourself at home with in case you have an exacerbation.
Yes, know that you're the most at risk. Be aware of your situation. Know what your baseline is, and be aware if you're getting worse.
Awesome. Thank you, guys. You guys are so important. Thank you for helping us. All right, question number 1 is, what are some reasons or symptoms you should come into the ED? And my answer is, I know it's scary right now and I want to go to the ER because you're worried about getting COVID-19, and that's totally understandable. There's so many options available for you right now. Last October, when my son was sick, we used telemedicine, which was great. You can be at the comfort of your home and just get set up to talk to a doctor in front of your iPad or your phone. And if you're worried you need some lab tests or results or something, they'll order that for you if they think you need it. If you need prescriptions, they send it off. It's really, really convenient. Now, you also have the option of urgent care if it's open. They are a great resource to help medically direct you of what you'll need, where to go. Now, if you've been having symptoms for a while and it's pretty stable, I would always suggest going to your primary care provider. They are number one for medical direction. If you need some additional testing or you need to go to the route of a specialist, they are there to help you. But of course, in the ER, it's a great place to go if you are having broken bones, if you're short of breath and having chest pain, left-sided, things like stroke symptoms. Those things are definitely a great place for you to go. But just explore your options first. Question number 2 is, what are the new changes in the ED and what can our viewers expect when they come in? Well, when you come in first, they're probably going to take your temperature just to make sure that if you have a temperature, they put you on the right side, because in our hospital, we separate our possible COVID patients from just regular ER concerns. And then you have less face-to-face interaction with your providers and staff with registration. So you might have to be in your room and talking to the doctor from the TV, like a TV in front of you. Your nurses or techs, they'll definitely do the rounding. They'll definitely check on you, but it's more, you'll see us all gowned and have all our proper PPE on. And it's just less personal than it used to be. So you definitely can expect that. Also, the new change that we implemented this week was the no visitor policy. So that's that. Question 3 is, what are your thoughts on the no visitor policy? And I know when you come to the ER, you may be worried, you may be having a heart attack, a stroke, you may even have to have a procedure get done for a broken bone. And I totally can sympathize with you. You need that support from your loved one or family member. And I totally get that. It's a scary situation when you're in the ER. But I think their main objective is everyone's safety. I feel, though, that there's got to be a balance. And for now, it's what's expected. So we do have to follow that. All right, Chris, what are some reasons or symptoms our viewers should come to the ED?
For our patients to come, I think the biggest easy one to know is any kind of trauma, any kind of head trauma from a fall, major bleeding of any kind, possible broken bones, stuff like that. It's a good reason to come to the emergency room. Symptom-wise, from illness, if you've got your own way of measuring what we call vital signs are the best thing that you can be checking to see if really you should be coming to an emergency room or not. Again, that's if your oxygen saturation is below 90, if your blood pressure is below 90 over 60, that's getting scary. If your respirations are high 20s or higher, pulses above 130 at a resting heart rate, these are all good reasons, or a temperature that's getting into the 102, 103. Keeping in mind that fever is actually a good thing. Fever is a mechanism our body uses to destroy infection, but it, kind of a give and take. It can't get too high or it can harm you, but counteracting the fever all the time can actually make things worse instead of making things better. But if it starts getting above 103, especially for a child who's getting a little too warm, they can get a little bit hotter, but 103, 104, it's a good reason to be coming into the emergency room. If your vital signs are fine, it's kind of just an expensive visit. Really, there's not a whole lot we can do for you if your vital signs are stable. If you feel that there are things that are bad but not super bad, then that's why an Instacare or your primary care would be a better and more appropriate use of your time and your finances.
Awesome. And then what are the new changes implemented here in the ED, and what can our patients expect when they come?
Big changes is all of this. As the COVID is hitting full effect, we're all getting a lot more protection, a lot more PPE. We have to wear this stuff all 12 hours of our shift. So if you're a patient coming, don't be alarmed in the fact that we're wearing all this, but be alarmed at the fact that there is a possibility that coming to an emergency room you will be exposed to the virus, or any sickness for that matter. There's always a risk to coming here because this is where sick people come.
Awesome. And how do you feel about the no visitor policy?
No visitor policy for 95 to 99% of our patients is great. We are trying to protect you. We're trying to protect your visitors, your loved ones. For the 1% who either are pediatric patients, there's more than 1%, but if you're a pediatric patient and you need a parent, that's understandable. If your loved one is altered to where they can't answer appropriately, then that's a good reason to have it. Or if you are given birth, or if your loved one is deceased. Those are reasons to come currently. But for now, everyone else should, if you are over the age of 18, should not have visitors for their protection, for your protection, for our protection.
Awesome. Thank you, Chris. Introduce yourself.
Yep. Hi, my name is Andre.
And what are you in the ER?
I'm one of the emergency physicians.
Great. And what are some symptoms or reasons our viewers should come to the ER?
Obviously, during the pandemic, during this time, if you are running a fever, if you feel like you're getting very short of breath to the point where you just can't even walk across the room, if it kind of gets to the point where there's any degree of confusion, or you're feeling kind of lightheaded kind of with those symptoms, or you really think your oxygenation is, compromised, then that would be kind of the reasons to come in for the, kind of for respiratory sorts of symptoms. Now, otherwise, other symptoms, people are going to get sick for other reasons also. And, if you're just having a little mild, say abdominal pain, or, kind of discomfort, or it's just a little bit of a, kind of rash that you're having, and, you really don't have much in the way of pain, or you're not having fever, there's no kind of confusion with this, or it's not just, rapidly increasing, then that's probably something that would be fine to stay home. Maybe you could try contacting your primary care provider. Maybe you could use one of the telehealth options that are out there. But if this abdominal pain is severe enough to, kind of double you over, it's completely out of ordinary from kind of what you've experienced before, you're feeling lightheadedness, or there's any degree of kind of confusion with this, then, you don't want to kind of wait too long before things get out of hand. Because, for example, if you end up having appendicitis, it's really easy to treat before it perforates. But if you wait, and sit on it too long and it perforates, then that becomes a much more complicated surgery. And there's other disease processes that can be like that too. So you don't want to end up waiting too long.
Awesome. And then what are the new changes implemented here in the ER, and what could our patients expect?
I think probably one of the biggest changes would be the visitorship. And if you're an adult, then you can't have any visitors, even here in the emergency department, especially kind of once you go into the hospital. And so you need to kind of expect a lot of those restrictions, and you're going to have to get updates from your significant other or family member, just make sure that they have their cell phone and make sure it's charged so they can call you and kind of give you the updates as to what's going on. You're going to see a lot more face masks and goggles and gowns, and that's basically to protect everybody, patients and staff. So it's a little awkward, and sometimes it seems a little impersonal, but it is kind of doing the best to make sure everybody stays as healthy as possible, and you don't come into the hospital and get something that you didn't have before.
Awesome. And then how do you feel about the no visitor policy?
I have mixed feelings about that. I understand where it's coming from, but I think that is very kind of difficult, for families, especially if somebody's coming in and they're sick enough to get admitted, and if they're sick enough to go to the ICU, and things get worse, like that's good, and they end up on a ventilator. You do have those stories that, if you do have COVID-19 and you get put on the ventilator, unfortunately, the odds of getting off of that ventilator aren't great. I mean, we're hearing a fatality rate of somewhere in the 60 to 80% range. And I think that's going to make it very difficult and challenging for families to process kind of the death of a loved one. And so I think we need to work out some better ways so we can, let family kind of be together kind of during some of these tough times, especially when patients really are going to be quite sick. And hopefully, as we learn more kind of about, kind of this illness, we'll be able to come up with some ways that will be safe, so families, and good close friends can be with each other kind of during these tough times.
Awesome. Thank you.
All right. Thanks.
Introduce yourself.
Hi, my name's Kirsten. I'm a nurse in the emergency department.
And what are some reasons or symptoms our viewers should come to the ED?
Reasons you should come into the ER, first and foremost, if you are concerned, it is appropriate to always call your physician. Usually they have an on-call number. That's a good place to call and get some information about whether you should or should not come into the ER. There's also usually here in Utah, Connect Care, which is a phone number that you can call and get connected with a physician. And it's a video conference that you can do as well, so that way they can assess you and determine whether or not you should come in. There's always risk if you come into the ER about exposure, so if your symptoms are mild, it is best to try to see if you can get tested outpatient first.
Awesome. And what are the new changes implemented in the ED, and what could our patients expect when they come?
New changes definitely you're going to notice right off the bat when you come into the emergency department. Just at first, you're going to be greeted differently. You no longer walk up to the registration desk. You'll be greeted by somebody who's going to offer you some hand sanitizer and take your temperature to determine if you have a fever. From there, you do your registration by phone number now, and there's the areas in the ER, at least at ours, is separated into 3 different waiting areas. Just general complaints. We have a respiratory area for adults, and then a respiratory area separate for pediatrics as well.
Awesome. And how do you feel about the no visitor policy?
I think the no visitor policy, from a human perspective, I do sympathize with our patients and their family members about having to come into the emergency department alone. It is for the benefit of the patient and the family, and also to protect your staff members here in the emergency department, because with community spread, you could be asymptomatic for up to 2 weeks before you start to have symptoms, and you would hate to spread that to other people or to get sick from other people just from visiting.
Awesome. Thank you, Kirsten.
You're welcome.
Introduce yourself.
Hi, I'm Gabby. I'm one of the critical care techs here in the ED.
And Gabby, what are some reasons or symptoms our viewers should come to the ED?
Reasons to come to the ED, basically, if you are, I guess, super injured, like an arm on the floor next to you, probably bring you and the arm in. We can help out with that. Chest pains, if you're having any left or right-sided weaknesses, things that you're really concerned about, like life-threatening things. If you're having a common fever or, things like that, you could probably call your primary care doctor, kind of talk to them and see what they suggest before coming in. But yeah, I think if it's something that you're not really concerned about your life for, I would definitely avoid the ER around this time.
Awesome. And what are the new changes implemented here in the ED, and what can our patients expect when they come?
New changes. I feel like things change every day. So even employees are trying to keep up with what's new and stuff. One of the big things I think is the no visitor policy. That's kind of a thing that people are having a hard time grasping, but it does make sense. We were trying to keep employees safe, other patients safe. We're trying to keep you safe. So I think that one's a big one that we're working on.
Okay. And how do you feel about that no visitor policy?
I feel it's good. I like it. I can see though, as a patient, it being kind of frustrating because, coming to the ER is kind of a scary experience. So having to do that alone is scary. But if you, sit down and realize why we're doing it, I think it's pretty beneficial to you, basically, So I think you just have to take a moment to realize why that's happening instead of getting defensive and, upset. I mean, we're here for you. That's what it is. You're not alone. We're all here for you. So just keep that in mind.
Okay, thank you, Gabby.
You're welcome.
Introduce yourself.
Hi, my name's Rebecca. I'm a nurse in the ER.
And what are some reasons or symptoms our viewers should come to the ED for?
If you have chest pain, you have difficulty breathing, really high fevers that aren't managed with ibuprofen and Tylenol, altered mental status, suicidal thoughts, or suicide attempt, we want to see you here for sure. Broken bones, if you need stitches and Instacare's closed, things like that.
Okay. And what are the new changes implemented here in the ED that our patients should know about or expect when they come?
That we now are trying to contain any patients that are respiratory patients in one area. If you're asked to sit in a separate area from other patients, it's not to be mean, it's to protect you and protect everyone else. And our visitor policy, you can't have visitors anymore. You can have one if you're under 18. And then patients that are dying are allowed visitors, but I believe it's only 2.
Awesome. And how do you feel about the no visitor policy?
I think it helps us a lot to get things done quickly. It's easier for us to accomplish our tasks without other people in the room. I also find it frustrating for those patients that are really sick and need somebody there to help support them, especially when they end up admitted and in the hospital for days at a time.
Awesome. Thank you, Becca. Justin, what are some reasons or symptoms our viewers should come to the ED?
If they have a dry cough, fevers, body aches, diarrhea, vomiting. Those are pretty good ones that they usually tell everybody.
Okay. And then what are the new changes implemented in the ER, and what could our patients expect when they come in?
So unfortunately, most departments are having at least a greeter, someone that when they come in, they'll meet them at the door, take a temperature, kind of do a couple of questions, cough, traveling, things like that. Unfortunately now, we're not allowing visitors to come in anymore, just to keep the family safe and also kind of limit how many people we do have gathering in the hallways, because sometimes family members do get concerned, which is understandable, and will kind of crowd the nurse's station, which not only are they exposing themselves to things in the hallways, but also exposing us to any diseases that they might have.
Okay. And then how do you feel about that no visitor policy?
Honestly, I'm not going to lie, I really do enjoy it, not only because we're kind of keeping the numbers down, or at least trying to, we're also keeping the family safe, but not just the family, but also us safe. And also, it's a good way to crowd control, because like I was saying previously, is families will tend to come into the hallways, which is understandable. You're a concerned family. You feel like your parent or whoever it may be needs attention. But unfortunately, we're obviously at the computer, either charting or just doing something important, either busy transferring a patient or trying to get some paperwork done. And sometimes they don't always understand that. But I feel like it's a really good reminder to say, hey, unfortunately I can't help you right now, and that's why we do have or utilize a call system, at least in this hospital.
Awesome. Okay, thank you, Justin. Introduce yourself.
Hi, my name's Lindsay. I'm a nurse in the ER.
And what are some reasons or symptoms our viewers should come to the ED?
If you are feeling like you're having chest pain, such as a heart attack, shortness of breath, with a fever or cough, you have an obvious deformity in one of your limbs, you have a major burn, a cut that requires stitches and it's in the middle of the night, that's just a few.
Yeah. And then what are the new changes implemented here in the ED, and what should our patients expect when they come?
So we wear our PPE all the time now. So mask and goggles, and then gloves with, when we go in a patient room, and then obviously gowns if
and PAPRs if we're concerned about any respiratory or COVID symptoms. And then changes that visitors should expect is we don't allow any visitors unless you're a pediatric patient or an altered mental status patient. You get one visitor, they can't rotate. Other than that, no matter what, no visitors.
All right, and how do you feel about that policy?
I think the policy is enacted to help keep people safe. And I think sometimes visitors can get in the way of our practitioners providing health care. I know it is hard for people to leave their loved ones here at the hospital and go away not knowing what's going on, but it's really to help keep the visitors safe and keep the patients safe.
Awesome. Thank you, Lindsay. All right, introduce yourself.
Hi, my name is Esperanza. I'm a critical care tech here in the emergency department.
And SB, what are some symptoms or reasons our viewers should come to the ED?
I think if you were to come to the ED for signs and symptoms, if you have signs and symptoms of like having a fever, cough, all that stuff, but to the point where you can't take care of it at home, like if you feel like your oxygen level is too low, or you have low blood pressure, or to the point where you need medical interventions, then you should be able to come in. If you're just experiencing a fever that you could take ibuprofen or Tylenol at home, stay at home. If you just have a cough or runny nose, stay at home. So like minor things, you probably shouldn't come into the ER, but if it's like something that you need medical interventions for, then I would think that you would need to come in.
All right, and what are the new changes implemented here in the ED, and what could our patients expect?
So we've had a lot of changes, of course, kind of just trying to adapt to the situations, but we have a lot of the like wearing masks and proper PPE all the time and protecting ourselves, and having the ability to triage out front to put the patients where they need to be as far as splitting up respiratory and non-respiratory patients. And then putting on PAPRs and doing COVID tests when needed, and making sure that our staff is safe, using PPE and stuff like that. I feel like is our biggest changes that we're trying to do is just to make sure that we're safe, because if we're not safe, we can't really take care of anybody if we're sick.
Awesome. And we do have that new visitor policy where they don't allow visitors except for pediatrics, one parent. How do you feel about the new visitor policy?
I do like this a lot. It just allows us, especially as medical staff here in the ED, to kind of control how many people we have back here in the emergency department, and also kind of limit the exposure of COVID, of course. And if we do have anybody positive, it limits that exposure. And if we have family and all that stuff, we can't promise them safety, And we try our best to keep the patients safe, but it's a lot easier to keep track of the patients than it is the family. So I think being able to control the patient, or to make sure there's no family or just no visitors at all, is a good way to keep everybody safe.
Awesome. Thank you, SB.
Okay, thank you.
All right. So the question this week is, what are some reasons or symptoms our viewers should come to the ED?
Well, fever, cough. Not like a Zoolander cough, not like, I have the blind. Like a real cough takes it out of you. Like you've got no energy, you're taking a shower and you can't even like stand, you're too beat, you're short of breath, you're breathing fast. That's when you should come to the ER. Obviously, if you're, coughing and sick, you feel like crap. But if you're still able to like get up, take a shower, make yourself some breakfast, still kind of go about your day, then you're probably okay to stay home.
All right. And what are the new changes implemented in the ED that our patients should know about?
No visitors. There's no visitors allowed. That's probably the biggest one, because people are really surprised at that when they get here. And it is. I can see why it's a little bit surprising. And then we're like getting your temperature the minute you walk in the door. If anyone, well, now that we're not having visitors, that doesn't matter. I was gonna say if your visitor has a fever, they have to go, but now there's no visitors. And then like we want a mask on you. If you're respiratory, we put you in like the plastic bag in the waiting room. And then we make you go to the other side if you're like a normal patient. So.
All right. And how do you feel about the no visitor policy?
I have mixed feelings about it. I understand why it's in place and why it's important, and it definitely, like, you know, even when we were talking about people like stay in your room, don't come out walking around the hall, it just still got so ignored. So I think that's why they had to crack down. So that's good. But then, like, it's hard. I had this really sweet lady who was pretty elderly, didn't really speak a lot of English, and her daughter was there, but we had to send her out. And I felt really bad about that. I felt like she was upset at that and probably could have used her daughter here, you know, but I have to say she was a trooper. She pulled through, you know. I did my best to figure out words to talk to her, and she actually understood a lot, but it was just tough. I felt bad kicking her daughter out when it felt like she needed her. So I have mixed feelings. I see why it's important. I see why we're doing it, but then I feel like sometimes we need to be flexible.
Awesome. Thanks, Nikki.
Yeah.
Introduce yourself.
Hi, my name is Nicole. I'm a nurse here in the ED.
And what are some reasons or symptoms our viewers should come to the ED?
Well, first of all, it's important to remember that if your symptoms are mild, stay home. Please stay home. You can contact your doctor's office if things are mild, and they can direct you from there on how to get tested if necessary. But reasons to come in and see us would be if you are experiencing difficulty breathing, or if you have an extremely high temperature, anything like that would be a reason to come in and see us. And you can always call us beforehand on your way.
All right, and what are the new changes implemented here in the ED, and what can our patients expect or know about coming?
Right now, we have instituted a new no visitor policy. Started a couple days ago. So with a few exceptions, patients here in the emergency department and in the hospital will not be allowed to have visitors. That's just to keep us all safe. And also, when you get to the waiting room, you will notice that there's kind of a respiratory area that we've sealed off just to try and isolate those patients a little more.
All right. And then how do you feel about the no visitor policy?
Like I said before, it's just to keep everybody safe and to help try and prevent the spread of this virus.
Awesome. Thank you, Nicole.
Thank you. Stay safe.
All right. So what are some symptoms or reasons our viewers should come to the ED?
So if you are truly short of breath, and not a lot of people can check their oxygen level at home, but if you can and it's, low, like in the 80s, then you should come see us. Anything below 90, that's sustained. But truly short of breath, you should come in. I would say chest pain, if it's the way, like true cardiac chest pain, so, it's radiating, there's lots of nausea, you're super sweaty, increased fatigue. Females, it's harder because they always present differently with heart attacks, but they would say it's just indigestion, or they're just not feeling well. But those are some reasons. Any type of stroke symptoms, we want to see you for sure. But don't come see us if you've had 2 hours of abdominal pain, just because we don't want to expose you. We're trying to limit exposure and flatten the curve. So abdominal pain is going to be a lot of different things, but if it's only been 2 hours, don't call us. Do online stuff. There's online telemedicine that you can do for your symptoms, but definitely stroke symptoms, anything that you would think is a heart attack, and difficulty breathing, and respiratory wise, and that you're COVID positive or you've been exposed. If you're going to come in, then try and be nice to the ER staff and call us and tell us, just so that we can already direct you where to go to stay separated from everybody else.
Awesome. What are the new changes implemented in the ED that our patients should know about?
Well, they change all the time, and they're changing constantly, but the biggest things is you're going to notice whether you're on our respiratory side or not respiratory side, we're always wearing masks and goggles. And that's just here to protect us, and just because there are people out there that don't have symptoms that are carrying it. They're not necessarily positive and they're infected and sick with it, but you can be a carrier. So you'll see us wearing that all of the time. And then there's a huge big change with the visitor policy, which I think we'll get into in a little bit. And then eventually we'll be doing a tent thing where you'll come through and see someone in a white tent first, and they'll direct you where to go. But just pay attention to signs and barricades. Don't try and go through a barricade if it's there, because we need you to come through the right way.
All right. And how do you feel about the no visitor policy?
So with kiddos, it's hard for parents, but we're again trying to limit exposure to everybody. So they get one parent, obviously, but then adult patients, they're not having any. And again, it's not because we don't want you to have a visitor. It's for their safety and so they don't get exposed. It's also for us too, right? You've been out and about in the community. We don't know what you have, and if you're bringing it and trailing it in, we're trying to limit all of that. And I think our curve has been pretty flat here so far, knock on wood, wherever that's at. But I like it, just for safety wise of caregivers and for your family members. You don't want them coming to the hospital and getting exposed unnecessarily. If you're actively dying, obviously you're going to get a visitor or two, and that's hard because, you know, everyone wants to say goodbye. So that part would be a little hard and emotional, but for the most part, I think it's the right thing to do.
Awesome. Thank you, Allie.
Thanks.
Here are my closing thoughts. We've been in our home since March 27, and recently I've seen some troubling things. We can't let fear control us to the point where we allow ourselves to be controlled like sheep. This fear is allowing people who claim to have our best interests at heart to use irrational threats like fines and jail time to a population already exhausted by endless negative news. Does this make sense to add more negativity to an already volatile situation? As a nurse who always tries to comfort my patients at their lowest, this approach bothers me. While on the topic of being a nurse and patient care, just know, speaking for myself, and I think most of my fellow healthcare workers, I feel honored to care for your family and friends, and I always try my best to provide the dignity, respect, and compassion that drew me to this line of work to begin with. To my fellow healthcare workers who may have lost that sense of compassion, I know how easy that can be as well. It's easy to remember that one patient who mistook your kindness for naivety, or the family member who ordered you around like a servant. This can be a thankless profession. I challenge you to instead remember that one patient who brought a smile to your face, or the family member who thanked you profusely for caring for their loved one. Never forget why we're doing this. We aren't heroes during this crisis. We are the foundation of humanity.